In this lesson, we'll continue our discussion of the cardiovascular system by taking a look at the anatomy and even a little bit of physiology of arteries and veins. We'll take a look at their structure and which way they flow blood. So I have a couple definitions I want to go over with you first. First of all, an artery is a blood vessel that carries blood away from the heart. That's the word you should be highlighting right now. Arteries away, right? A for arteries, A for away. Regardless of the type of blood that's in the heart, whether it's in the blood vessel, whether it's oxygenated or deoxygenated. We don't care about that. We just care about which direction the blood is flowing. As you go on in your studies, you'll actually see there's different types of arteries. We have elastic arteries, which you can kind of guess from the name are going to have more elastic fibers in them. These are typically found closer to the heart. And think about this, when the heart contracts and it pushes blood into the arteries, that's a lot of blood going into the arteries. The artery needs to expand a little bit to take in all of that blood. So we typically find these elastic arteries closer to the heart. As the arteries get further away from the heart, they don't have as much elastic fibers and they become more muscular, right? They have more smooth muscle cells, and those smooth muscle cells allow the blood vessel to change their diameter, right? Sometimes they'll dilate, we call that vasodilation. Sometimes they constrict, we call that vasoconstriction, and that can help to control the movement of blood throughout the body. All right, so the main thing there, arteries carry blood away. Now, as the arteries get smaller and smaller and become even microscopic, we're going to change their name. We're going to call them arterioles. These are the smallest branches of arteries, right? They're going to bring the blood into what we call a capillary bed. And within the capillary bed are the smallest blood vessels that we call capillaries. Right? So arterioles continue to bring the blood away from the heart, but into a capillary bed. Now, the capillaries within a capillary bed, these are the smallest blood vessels, right? If you were to look at them under the microscope, they're just one thin layer of cells. There's no muscle around it, there's no outer coat, right? It's just one thin layer of cells. And by being one thin layer of cells, it allows for gas exchange between the blood and the tissues. Oxygen can go from the bloodstream into the cells, and then carbon dioxide can go the opposite way. Same thing with nutrients and waste, right? The nutrients into the cells, waste products into the blood, right? But we have to have these thin blood vessels to do that, and these are known as capillaries. Now, the blood leaving the capillary bed is going to go into what we call venules. These are microscopic veins, and you can kind of guess that veins are now going to return the blood back to the heart, right? So venules collect blood from the capillaries and ultimately return the blood back to the heart by becoming veins. Venules become veins, and the veins get bigger and bigger, and they return the blood back to the heart. Okay, so those are the general definitions and the direction of blood flow. So let's take a look at the actual structure of a blood vessel. We're going to see whether it's an artery or a vein. The wall of a blood vessel has three distinct layers. These layers are known as tunics. A tunic is basically a coat, right? There's going to be an inner coat, a middle coat, and an outer coat, right? We call the inner coat the tunica intima. We call the middle coat the tunica media, and we call the outer coat the tunica externa. So let's start by looking at the tunica intima first. Again, this is going to be the inner layer, and it has three components. The innermost part is known as the endothelial lining. We sometimes say the endothelium, and this is just a single layer of flat cells, so it would be a layer of simple squamous epithelium. Right? So these are the cells that are actually up against the blood. Just outside the simple squamous epithelium, we're going to have a thin layer of connective tissue. This is actually areolar connective tissue. And just so you know, guys, as you go on in your studies, regardless of what system that you look at, whenever there's epithelium, just underneath the epithelium or just outside the epithelium, you're going to have areolar connective tissue. These two things, epithelium and areolar connective tissue, always go hand in hand. Just kind of keep that in the back of your mind. Now, the third component of the inner layer, the tunica intima, is something known as the internal elastic membrane. But notice, this is important, they are only found in arteries. They do not exist in veins. And what this is just a layer of elastic fibers, right? They're just kind of be on the outer border of the tunica intima. So let's take a look at a picture. I think makes this a little bit easier to understand. This is actually one of my favorite pictures. This is a microscope slide of a vein and an artery, and you can see it's at low power where you don't really have to zoom in very high. This is at 60 times, and what we're seeing here, guys, is an artery, and up over here is a vein. And what they did was they took a slice of the arterial wall here, and you follow this arrow, and they blew it up to this. And then they did the same thing here. They took the slice of the wall and they blew it up for us here. So let's take a look at the tunica intima of an artery first. So we'll come over here. If you follow this deeper purple of cells, this is going to be the endothelium. This would be the simple squamous epithelium. Then the lighter purple just outside it, right underneath the simple squamous cells, this lighter purple, if you follow my cursor, this is the areolar connective tissue. Then see these squiggly lines right out here? That is the internal elastic membrane, right? That's going to be only in arteries. We don't see that in veins. Right, so these three components, one, the deep purple, two, the light purple, and three, the squiggly lines. Endothelium, areolar connective tissue, internal elastic membrane. They make up the tunica intima of an artery. Let's compare it to a vein. So now we want to come over here. So here you can see the nice flat cells. These are the simple squamous cells, which we call the endothelium. Then underneath the endothelium, there's always going to be areolar connective tissue. That's this lighter purple. But notice, no squiggly lines, right? That's because the internal elastic membrane does not exist in veins, right? It's only going to be found in arteries. Okay, let's take a look now at the tunica media, right? This is going to be the middle layer. The predominant cells we're going to see here, guys, if you want to highlight, is smooth muscle, right? There's going to be a lot of smooth muscle, and there can be another elastic membrane known as the elastic membrane. Notice only found in arteries, absent in veins. So both this external elastic membrane I'm mentioning now, and then from the previous slide, the internal elastic membrane, are only found in arteries, right? We don't see them in veins. Let's take a look. So let's look at the artery first. So now we're looking at this middle layer. Right, this whole middle layer here, if you notice, right, tons of smooth muscle cells. Right, tons of smooth muscle cells, and then kind of out here, this line right here, this represents a layer of elastic fibers known as the external elastic membrane, kind of like where my cursor is here. All right, so smooth muscle cells, external elastic membrane. These squiggly lines here also represent some elastic fibers. This is probably an elastic artery, that would be my guess. Over here, guys, notice only smooth muscle cells, no elastic fibers, and no external elastic membrane out over here. And again, the reason for that is veins do not contain an internal elastic membrane, nor do they contain an external elastic membrane. Finally, the tunica externa, right? This is going to be the outer layer. Let's say you were doing dissection, right? And you saw a blood vessel and you kind of grabbed it and picked it up. What you would be touching is the outer layer. That is the tunica externa. And its job is to connect the blood vessel to adjacent structures so that the blood vessel doesn't move around and become damaged. So in arteries, the predominant feature is collagen and some elastic fibers. In veins, we also see predominantly collagen, some elastic fibers, but what's unique to veins is it contains some smooth muscle cells. All right, so collagen is common to both, elastic fibers is common to both, but smooth muscle cells is only going to be found in veins. Let's take a look. So if you look at over here, this yellow represents like collagen, and then the blue squiggly lines represent elastic tissue. Over here, collagen, and they don't really show the elastic fibers very much. There's not really that many of them. So this would be predominantly collagen. But see these cells here? Right? They're similar to these cells in here. Those are the smooth muscle cells, right? They're going to be the smooth muscle cells. Okay, so again, that's unique to veins. One other thing before we move on is that in large blood vessels, whether they're arteries or veins, right? Really large arteries or veins. Like you may have heard of the aorta. That's an artery. You may have heard of the vena cava, right? Superior vena cava or the inferior vena cava. Those are really large veins. These blood vessels are so large that they have their own blood supply. There are small blood vessels which bring oxygen and nutrients to these large blood vessels. They're basically nourishing the large blood vessels. We call them the vasa vasorum, and that literally means the blood vessels of the blood vessels. All right, so these are small arteries or veins. They're located within the walls of large arteries and veins, and basically they're supplying nutrients and oxygen to the tunica media and the tunica externa of these large blood vessels. All right, so those are called the vasa vasorum. Okay, so these charts down over here, I'm going to go over now. I have this on the next slide. Just kind of going over some of the things that we could use to determine whether we're looking at an artery or a vein. So first of all, arteries and veins typically run side by side. Even nerves, artery, veins, and nerves kind of run as a triad, as a triplet together. So if you go back to this picture here, we see here's an artery, and right next to it is a vein, right? Maybe over here there could be a nerve, right? We'd actually see the three of them together. All right, so you're going to see them side by side. Arteries, if you notice, you probably picked this up already, are going to have thicker walls. Right? It's one of the things I look at too, is just the thickness. See how thick the artery is compared to the vein. The artery lining has folds. It has like a rippled appearance. If you take a look, I'll show you here. See how the endothelium is rippled? That's classic artery, where in a vein, nice and smooth. Arteries are going to be more elastic, right? We know that because the artery has the external elastic membrane, the internal elastic membrane. It has elastic fibers in the tunica media. It has elastic fibers in the tunica externa. So we kind of know that already. And the shape of the lumen, right? The lumen is the hollow part of an organ. So the hollow part of a blood vessel is known as a lumen. That's where the blood would flow. The artery has a round lumen. So if you take here, this is basically a round hollow area where the vein is more collapsed, kind of has a more of an oval shape, more collapsed appearance. Right, so the artery has a round lumen, a vein has a large flat lumen. The lining, especially the tunica externa of a vein, can contract where the vein had some smooth muscle. The last thing, veins have valves. We said that veins direct the blood back to the heart. We don't want veins to backflow blood in the opposite direction, right? We need the blood to go back to the heart. And think about this for a minute. If you were standing upright, all the blood in your foot has to get back to your heart. So as it would be moving in the veins going back to your heart, we wouldn't want gravity to pull it back down. So the veins prevent that, right? They prevent that backflow. An example of a pathology, if you've ever seen anybody with varicose veins, right? Those are problems where the veins become damaged or they become incompetent and they allow for backflow, and now the blood vessel becomes engorged, it becomes enlarged, right? So that ends this lesson comparing a vein to an artery, both anatomically and functionally.